Welcome, future nurses. Get ready to power up your NCLEX preparation because our 30-day NCLEX challenge is in full swing. Every single day, we bring you one complete practice test packed with 75 high-yield, exam-focused questions that have been carefully selected to reflect what actually appears on the NCLEX. By the end of this 30-day journey, you won't just have practiced. You'll have mastered over 2,000 of the most important questions that could decide your success on exam day. Today is day 6, and we're diving into Practice Test 6. Let's test your knowledge, boost your confidence, and bring you one step closer to passing the NCLEX on your first attempt, which involves a scenario focused on therapeutic communication and prioritizing the nursing process. A hospitalized client has refused a prescribed subcutaneous injection of heparin. What is the most appropriate initial action the nurse should take? The options are A. Document the client's refusal in the medical record. B. Notify the primary healthcare provider. C. Review the client's latest platelet count. Or D. Explore the client's reason for refusing the medication. The correct answer is option D. Explore the client's reason for refusing the medication. Here is the rationale. According to the nursing process, assessment must always come first before planning or intervention. Instead of acting prematurely by documenting or notifying the healthcare provider, the nurse should begin by understanding why the client is refusing the medication. The refusal could stem from fear, confusion, misinformation, or cultural concerns. Exploring the reason allows the nurse to provide education about the purpose of heparin, such as its role in preventing life-threatening blood clots, and helps clarify any misconceptions. This approach supports informed decision-making while respecting the client's autonomy and building a therapeutic nurse-client relationship. Now let us move on to a question 2 involving priority setting in a behavioral health scenario. The nurse is reviewing the plan of care for a client recently admitted to the behavioral health unit with anorexia nervosa. Which of the following goals should the nurse identify as the priority for this client? The options are A. Attend all scheduled group therapy sessions. B. Adhere to the prescribed medication regimen. C. Gain 1 pound, approximately half a kilogram per week. Or D. Demonstrate improved self-esteem during interactions. The correct answer is option C. Gain 1 pound per week. Here is the rationale. In clients with anorexia nervosa, the most urgent concern is restoring physiological stability, particularly reversing malnutrition and promoting gradual weight gain. Severe anorexia may result in dangerously low body weight, bradycardia, electrolyte imbalances, and even cardiac arrest. A target of gaining 1 pound per week is widely accepted as safe and effective in supporting nutritional rehabilitation without risking refeeding syndrome. According to Maslow's hierarchy of needs, physiological needs such as nutrition and hydration must be addressed before psychological or emotional goals like self-esteem and therapy participation. Although therapy and medication may be helpful in the long term, they are secondary to ensuring the client's physical survival in the acute phase of care. Next, let us examine a situation that focuses on infection prevention and central line care. Question 3. During a routine assessment, the nurse observes that a client's central venous catheter dressing is loose and visibly wet. What is the nurse's most appropriate action? The options are A. Secure the dressing by reinforcing it with paper tape. B. Remove the dressing and immediately discontinue the central line. C. Place a clean occlusive dressing over the existing one. Or D. Remove the soiled dressing, cleanse the site, and apply a new sterile dressing. The correct answer is option D. Remove the soiled dressing, cleanse the site, and apply a new sterile dressing. Here is the rationale. A loose and damp dressing on a central venous catheter is no longer sterile and is a direct risk for infection, especially central line-associated bloodstream infections. The nurse must use medical asepsis to carefully remove the soiled dressing, cleanse the insertion site, typically with chlorhexidine, and then apply a sterile occlusive dressing under full surgical aseptic technique. Simply reinforcing or covering the old dressing does not eliminate the contamination. Timely intervention and strict aseptic technique are critical in maintaining central line integrity and reducing life-threatening complications. Now, shifting to the topic of immunizations, let us consider this question on preventive pediatric care. Question 4. The nurse is educating a parent about the human papillomavirus, HPV, vaccine during a routine health visit. Which group of clients is the primary target population for this vaccine? The options include A. Adults aged 65 years and older, B. Pregnant women, C. Children aged 11 to 12 years, or D, infants at 6 months of age? The correct answer is option C, children aged 11 to 12 years. Here's the rationale. The HPV vaccine is routinely recommended for children between the ages of 11 and 12, ideally before any sexual activity begins, to maximize protection against high-risk HPV strains. The vaccine can be given as early as age 9, and for those who begin the series before age 15, only 2 doses are needed. HPV types 16 and 18 are most commonly associated with cervical and other genital cancers, while type 6 and 11 cause genital warts. Vaccinating preteens offers strong immunity before any potential exposure. It is not advised for older adults, pregnant women, or infants, as it provides little benefit or has not been proven safe in those populations. Let us consider a critical care visual emergency that tests your understanding of ocular assessment. Question 5. The nurse is assessing a client with suspected retinal detachment. Which of the following findings would be least consistent with this diagnosis? The options are A, seeing floating spots in the vision, B, describing a sensation of a curtain covering part of the vision, C, seeing sudden flashes of light, or D, experiencing severe eye pain. The correct answer is option D, experiencing severe eye pain. Here is the rationale. Retinal detachment typically presents as a painless visual disturbance and does not involve severe or intense eye pain. Common symptoms include floaters, flashes of light, and the classic curtain or shadow effect across the visual field as the retina separates from the underlying tissue. Pain is more indicative of acute conditions such as angle closure glaucoma rather than retinal detachment. Identifying the correct symptoms is essential because retinal detachment is a time-sensitive emergency. Prompt surgical repair is required to preserve vision and prevent permanent blindness. Let us now shift into a critical scenario 6 involving medication safety and emergency nursing response. The nurse is managing care for a client admitted with diabetic ketoacidosis who has been prescribed a regular insulin bolus of 0.1 unit per kilogram, followed by a continuous infusion. However, the nurse mistakenly administers 1 unit per kilogram instead. What is the most appropriate initial nursing action? The options are A, contact the primary healthcare provider immediately, B, complete a medication error and safety incident report, C, monitor the client closely for signs and symptoms of hypoglycemia, or D, delay the start of the continuous insulin infusion. The correct answer is option C, monitor the client closely for signs and symptoms of hypoglycemia. Here is the rationale. When a medication error involving insulin overdose occurs, the nurse's immediate priority is client safety. Administering 10 times the prescribed dose places the client at significant risk for hypoglycemia, which can present rapidly. The nurse must assess for signs such as confusion, tremors, diaphoresis, and slurred speech, and perform immediate bedside glucose monitoring. While contacting the provider and completing documentation are necessary steps, they follow the essential first response, assessing the client's current status to intervene without delay and prevent life-threatening complications. Still stuck in your NCLEX prep? Tired of reading endless books and watching boring lectures with no results? This is your wake-up call. You do not have to study for months. You just need the right strategy. At Stancoast NCLEX Coaching, we have helped thousands of students pass on their first or next attempt, and now it is your turn. With 100 hours of animated crash course videos, 500 hours of in-depth recorded lectures, 15 CAT-style mock tests, and a 5,000-question NCLEX Q-Bank, we cover everything you need, from test-taking strategy to pharmacology, prioritization, and NGN questions. Plus, you get access to a weekly study planner, exclusive NCLEX ebook, and 1 full year of course access. Enroll now. Link is in description. Moving into a safety and facility protocol topic, question 7. Let us consider a scenario from staff orientation. A nurse is reviewing safety policies with new employees during orientation at a healthcare facility. Which statement best reflects the facility's expectation for security training among staff? The options are A, all doors in the facility must have egress alarms except for patient rooms, B, every staff member must receive education and training related to facility security, C, only staff with direct patient care responsibilities need security training, or D, clerical employees are exempt from security-related training requirements. The correct answer is option B, every staff member must receive education and training related to facility security. The rationale here, is that facility safety is a shared responsibility, and every employee, clinical and non-clinical, must be equipped to recognize and respond to security threats. Whether dealing with workplace violence, lockdown protocols, or data protection, staff in all roles play a vital part in maintaining a secure environment. Limiting training to direct care providers overlooks the fact that threats can arise anywhere in a healthcare setting. Comprehensive training for all personnel helps foster preparedness, reduce risks, and protect patients, visitors, and staff alike. Switching focus to stroke management and emergency intervention, here is a case involving a cerebellar infarction. Question 8. The nurse is preparing an educational session on stroke management for new staff. Which of the following is considered the most appropriate treatment for a client presenting with acute cerebellar infarction within 4.5 hours of symptom onset? The options are A. Mechanical thrombectomy, B. Ventriculostomy, C. Decompressive suboccipital craniotomy, or D. Intravenous thrombolysis with recombinant tissue plasminogen activator, RTPA. The correct answer is option D. Intravenous thrombolysis with recombinant tissue plasminogen activator, RTPA. The rationale is that for clients with ischemic stroke, including cerebellar infarcts, thrombolytic therapy is the gold standard if administered within 4.5 hours of symptom onset. This medication helps dissolve the clot and restore blood flow, significantly improving outcomes and minimizing long-term deficits. While surgical interventions like craniotomy or ventriculostomy may be needed in severe cases, they are not first-line. Mechanical thrombectomy is typically reserved for large vessel occlusions. Early recognition and administration of RTPA is a time-sensitive intervention that can be life-saving in stroke care. Question 9. Now let us consider a newborn care scenario that focuses on thermoregulation. The healthcare provider is providing immediate care to a newborn following delivery. Which nursing action is most effective in preventing radiant heat loss in the newborn? The options are A. Drying the newborn's skin thoroughly with a towel, B. Placing the newborn on a padded and covered surface, C. Using warmed and humidified oxygen therapy, or D. Positioning the newborn's bassinet away from external windows or cold walls. The correct answer is option D. Positioning the newborn's bassinet away from external windows or cold walls. The rationale lies in understanding how newborns lose heat. Radiant heat loss happens when heat transfers from the baby's body to cooler surfaces nearby that are not in direct contact, such as windows, walls, or air vents. By ensuring the bassinet is positioned away from these environmental elements, the nurse reduces the newborn's risk of hypothermia. While drying the newborn prevents evaporative loss and padded surfaces reduce conductive loss, it is strategic placement that combats radiant loss most effectively in this case. Question 10. Turning now to maternal care and labor progression. Here is a case involving labor dystocia. The nurse is caring for a client diagnosed with labor dystocia, characterized by prolonged or difficult labor due to ineffective uterine contractions. Which medication does the nurse most likely anticipate the primary healthcare provider will prescribe to promote labor progression? The options are A. Oxytocin, B. Terbutaline, C. Magnesium sulfate, or D. Betamethasone. The correct answer is option A. Oxytocin. Here is why. Oxytocin is a uterotonic agent used to stimulate uterine contractions in clients experiencing slow or stalled labor. It promotes cervical dilation and fetal descent when administered intravenously and titrated carefully. In contrast, medications like terbutaline and magnesium sulfate are used to suppress labor, especially in preterm situations, and betamethasone is a corticosteroid given to enhance fetal lung development, not to initiate labor. In labor dystocia, where contractions are weak or ineffective, oxytocin remains the drug of choice for safely advancing labor progression under continuous monitoring. Question 11. Let us take a look at a question involving developmental norms and sleep requirements in children. Which of the following developmental age groups is correctly matched with the recommended total hours of sleep needed in a 24-hour period, including naps? The options are A. Neonates, 14 to 16 hours per 24-hour period. B. Infants, 12 to 14 hours per 24-hour period. C. Toddlers, 11 to 14 hours per 24-hour period. Or D. Preschoolers, 12 to 14 hours per 24-hour period. The correct answer is option C. Toddlers, 11 to 14 hours per 24-hour period. According to pediatric sleep guidelines, Toddlers between the ages of 1 and 3 years typically require 11 to 14 hours of total sleep per day, which includes nighttime sleep and at least one nap. This amount supports proper cognitive development, growth, and emotional regulation. Neonates generally sleep much more, closer to 16 to 18 hours. Infants need slightly more than 14 hours, and preschoolers begin needing slightly less, averaging 10 to 13 hours. Consistent, age-appropriate sleep routines help build healthy sleep habits and prevent behavioral issues related to sleep deprivation. Question 12. Let us now turn to a neonatal scenario involving a potentially life-threatening gastrointestinal condition. The healthcare provider is assessing a newborn suspected of having Hirschsprung's disease in the neonatal unit. Which clinical finding is most consistent with this diagnosis? The options include A. Abdominal distension, B. Urinary retention, C. Hematemesis, or D. Palpable abdominal mass. The correct answer is option A. Abdominal distension. Here is the rationale. Hirschsprung's disease is a congenital disorder caused by the absence of ganglion cells in a segment of the distal colon, which leads to a functional bowel obstruction. As a result, one of the most consistent signs in neonates is progressive abdominal distension. Additional symptoms may include failure to pass meconium within the first 24 to 48 hours, poor feeding, and chronic constipation. Urinary retention is more typical of neurological or genitourinary conditions. Hematemesis suggests upper gastrointestinal bleeding. And a palpable abdominal mass is more characteristic of hypertrophic pyloric stenosis. Nurses must also monitor for enterocolitis, a dangerous complication of Hirschsprung's disease marked by fever, foul-smelling diarrhea, and rapid deterioration. Still stuck in your NCLEX prep? Tired of reading endless books and watching boring lectures with no results? This is your wake-up call. You do not have to study for months. You just need the right strategy. At Stancoast NCLEX Coaching, we have helped thousands of students pass on their first or next attempt. And now it is your turn. With 100 hours of animated crash course videos, 500 hours of in-depth recorded lectures, 15 CAT-style mock tests, and a 5,000-question NCLEX question bank. We cover everything you need, from test-taking strategy to pharmacology, prioritization, and NGN questions. Plus, you get access to a weekly study planner, exclusive NCLEX ebook, and 1 full year of course access. Enroll now. Link is in description. Question 13. Next, let us explore a question about surgical readiness and prioritizing abnormal laboratory findings. The nurse is reviewing the preoperative laboratory results of a client scheduled for elective surgery. Which of the following values is most concerning and should be reported immediately? The options are A. Glycosylated hemoglobin, HbA1c, of 7.2%, B. International normalized ratio of 3.5, C. Hematocrit of 42%, or D. Blood urea nitrogen, BUN, of 5 milligrams per deciliter. The correct answer is option B, International normalized ratio of 3.5. Here is the rationale. An international normalized ratio of 3.5 indicates a significantly increased bleeding risk, especially if the client is on anticoagulants like warfarin. This result is well above the normal range and must be corrected prior to surgery to prevent excessive intraoperative bleeding. While an HbA1c of 7.2% indicates suboptimal long-term glucose control, it is not an immediate surgical contraindication. A hematocrit of 42% is within the normal range, and a slightly low BUN is generally not critical. Preoperative safety depends on addressing abnormal coagulation values first. Question 14. Shifting to musculoskeletal care, here's a question involving proper positioning during skeletal traction. The nurse is caring for a client with a femur fracture who is placed in Buck's traction. To maintain alignment and reduce complications, to what degree should the head of the bed be elevated? The options are A. 15 degrees, B. 90 degrees, C. 60 degrees, or D. 45 degrees. The correct answer is option A. 15 degrees. The rationale is that Buck's traction requires minimal elevation, typically between 10 to 20 degrees, to maintain effective traction force without compromising alignment or causing the client to slide downward. Elevating the bed to 45, 60, or 90 degrees interferes with the direction of pull and can increase pressure on the sacrum or misalign the limb. Nursing care includes ensuring weights hang freely, performing neurovascular checks, and monitoring skin integrity to prevent complications such as pressure ulcers and nerve damage. Question 15. Continuing with neurologic care, let us now examine a question on seizure classification. While monitoring a client with epilepsy, the nurse observes a sudden, brief episode in which the client loses muscle tone and collapses. The event lasts only a few seconds, and the client quickly recovers. How should the nurse document this seizure activity? The options are A. A tonic seizure, B. Tonic-clonic seizure, C. Absent seizure, or D. Complex partial seizure. The correct answer is option A. A tonic seizure. Atonic seizures, also called drop attacks, are marked by a sudden loss of muscle tone, often resulting in unexpected collapse. They are typically very brief, but pose a significant risk for injury due to the suddenness of the fall. Tonic-clonic seizures involve a sequence of muscle stiffening, followed by jerking, and last much longer. Absent seizures are characterized by brief loss of awareness without falling, and complex partial seizures involve automatisms and altered consciousness, but typically do not include full collapse. Recognizing seizure types accurately is vital for documentation and treatment planning. Question 16. Let us now look at an important pediatric infectious disease scenario. A nurse is assessing a 4-month-old infant who presents with weakness, poor feeding, constipation, and difficulty swallowing. Based on these symptoms, the nurse suspects infant botulism. Which statement best describes the cause of this condition? The options are A. Ingestion of Clostridium tetani spores, B. Ingestion of Clostridium botulinum spores, C. Consuming food contaminated with salmonella, or D. Inhalation of botulinum toxin. The correct answer is option B. Infant botulism occurs when infants ingest spores of the bacterium Clostridium botulinum. The rationale is that infants, especially those younger than 6 months, have underdeveloped gut flora, which allows these spores to colonize and produce neurotoxin. This leads to hypotonia, poor sucking, and potentially life-threatening respiratory issues. Clostridium tetani causes tetanus, not botulism. Salmonella typically causes gastroenteritis, not neuromuscular paralysis. Inhalation botulism is extremely rare and not a typical pediatric concern. Educating parents to avoid giving honey to infants under 1 year is a key preventive strategy. Question 17. Now let us transition to endocrine post-operative care. A client who recently underwent an adrenalectomy is admitted to the intensive care unit and is receiving intravenous hydrocortisone. Which nursing intervention is most important to include in the client's immediate care plan? The options are A. Monitor blood glucose levels frequently, B. Maintain the client in a supine position for 24 hours, C. Discontinue hydrocortisone once vital signs stabilize, or D. Provide wound care education for home discharge. The correct answer is option A. Monitor blood glucose levels frequently. The rationale is that hydrocortisone, a corticosteroid, raises blood glucose levels, and clients in critical care are especially prone to stress-induced hyperglycemia. Monitoring glucose is essential to prevent complications like infection, delayed healing, and metabolic imbalance. Supine positioning for 24 hours is inappropriate, and discontinuing hydrocortisone without a taper is unsafe. While education is important, it is not the top priority in the ICU phase. Post-adrenalectomy care requires close surveillance for adrenal insufficiency and glucose derangements. Question 18. Up next is a question related to cognitive changes in older adults. The nurse is caring for an older adult client who is experiencing delirium for the 3rd time in 4 months. When reviewing the medical record to determine a possible cause, which area should the nurse prioritize? The options are A. Vital signs, B. Height and weight, C. Family medical history, or D. Current medications. The correct answer is option D. Current medications. Here is the rationale. Polypharmacy is a leading cause of delirium in the elderly, often due to medications with anticholinergic or sedative effects. Reviewing the medication list helps identify agents that may be contributing to these repeated episodes. Although vital signs and nutrition can contribute, they are less likely to explain recurrent delirium. Family history is not directly related to acute cognitive fluctuations. Nurses play a vital role in identifying medication-related causes and collaborating with providers and pharmacists to reduce unnecessary prescriptions. Question 19. Let us now shift our focus to post-operative complications and preventive care. The nurse is caring for a post-operative client who is considered high risk for developing pneumonia. Which of the following interventions would be most effective in reducing the client's risk for this complication? The options are A. Passive range of motion exercises, B. Use of sequential compression devices, C. Early ambulation, or D. Administration of prophylactic antibiotics. The correct answer is option C. Early ambulation. Here is the rationale. Early ambulation significantly enhances lung expansion, facilitates secretion clearance, and improves circulation, making it one of the most effective ways to prevent post-operative pneumonia and venous thromboembolism. In contrast, passive range of motion exercises primarily preserve joint mobility, while SCDs help prevent blood clots but do not benefit respiratory function. Prophylactic antibiotics are not standard for pneumonia prevention and may lead to resistance if used unnecessarily. Ambulating within the first 24 hours post-surgery is a powerful and evidence-based strategy to promote pulmonary hygiene and overall recovery. Still stuck in your NCLEX prep? Tired of reading endless books and watching boring lectures with no results? This is your wake-up call. You do not have to study for months. You just need the right strategy. At Stancoast NCLEX Coaching, we have helped thousands of students pass on their first or next attempt, and now it is your turn. With 100 hours of animated crash course videos, 500 hours of in-depth recorded lectures, 15 CAT-style mock tests, and a 5,000-question NCLEX question bank, we cover everything you need, from test-taking strategy to pharmacology, prioritization, and NGN questions. Plus, you get access to a weekly study planner, exclusive NCLEX ebook, and 1 full year of course access. Enroll now. Link is in description. Question 20. Next, let us explore an urgent telemetry scenario that requires quick decision-making. The nurse is monitoring a client on continuous cardiac telemetry when the alarm sounds and the monitor no longer displays QRS complexes. What should be the nurse's first action? The options are A. Press the record button on the electrocardiogram machine, B. Check the client's lead placement and assess the equipment, C. Call the hospital's code team, or D. Notify the healthcare provider. The correct answer is option B. Check the client's lead placement and assess the equipment. The rationale is that before assuming a critical rhythm like a systole, the nurse must first verify that the leads are correctly attached and functioning. False alarms due to dislodged leads or technical errors are common in telemetry. Pressing record or contacting the provider is premature without confirming the accuracy of the data. Initiating a code response without confirming the rhythm may lead to inappropriate use of emergency resources. The nurse must always visually assess the patient and equipment first to ensure the situation warrants escalation. Question 21. Now let us examine a sensitive issue involving newborn safety in the postpartum setting. The nurse enters a postpartum client's room and the client states, "Another nurse just came and took my baby to the nursery." What is the nurse's initial action? The options are A. Alert hospital security and call a code pink for infant abduction, B. Ask the client to describe the appearance of the nurse who took the infant, C. Call the nursery to verify if the newborn was returned there, or D. Ask the client whether she requested the security code word from the nurse. The correct answer is option C. Call the nursery to verify if the newborn was returned there. Here is the rationale. Verification is the first and most responsible step before escalating the situation. While infant abduction is a serious concern, acting without confirming facts could create unnecessary panic. If the infant is not in the nursery, then appropriate steps like alerting security or initiating a code pink may follow. Questioning the client about identification or code words may delay critical verification and could unintentionally shift responsibility. Immediate, calm communication with the nursery ensures patient safety and clarity. Question 22. Let us move into oncologic pharmacology with a question involving chemotherapy support. The nurse is caring for a client undergoing chemotherapy who has been prescribed Ocular. Which laboratory finding would best indicate that the medication is producing its intended therapeutic effect? The options are A. Hemoglobin of 14 grams per deciliter, B. White blood cell count of 6,500 per cubic millimeter, C. Platelet count of 155,000 per cubic millimeter, or D. Prothrombin time of 11 seconds. The correct answer is option C. Platelet count of 155,000 per cubic millimeter. The rationale is that oprelvacin is a thrombopoietic growth factor, used to stimulate platelet production in clients at risk for chemotherapy-induced thrombocytopenia. A platelet count within the normal range indicates that the medication is effectively preventing bleeding complications. Oprelvacin does not influence hemoglobin, white blood cell counts, or coagulation times, so those values are not relevant to its efficacy. Nurses should monitor platelet trends closely to evaluate the therapeutic benefit and safety of the medication. Question 23. Shifting to electrolyte balance and renal care, consider this question about managing hypocalcemia. The nurse is administering phosphate-binding medications to a client diagnosed with hypocalcemia. What is the primary reason for using this medication in this client? The options include A. As phosphorus is excreted, calcium is also eliminated from the body. B. Calcium levels are directly regulated by the excretion of phosphorus. C. When serum phosphorus levels decrease, serum calcium levels increase. Or D. Phosphorus must exceed 4.5 milligrams per deciliter before calcium levels can begin to rise. The correct answer is option C. When serum phosphorus levels decrease, serum calcium levels increase. This is due to the inverse relationship between calcium and phosphorus in the body. High phosphorus binds to calcium, reducing free ionized calcium levels. Lowering serum phosphate through phosphate binders helps increase available calcium. The other options either misstate physiological relationships or introduce incorrect thresholds. Understanding this balance is critical in conditions like chronic kidney disease, where mineral metabolism is disrupted. Still stuck in your NCLEX prep? Tired of reading endless books and watching boring lectures with no results? This is your wake-up call. You do not have to study for months. You just need the right strategy. At Stancoast NCLEX Coaching, we have helped thousands of students pass on their first or next attempt, and now it is your turn. With 100 hours of animated crash course videos, 500 hours of in-depth recorded lectures, 15 CAT-style mock tests, and a 5,000-question NCLEX question bank, we cover everything you need, from test-taking strategy to pharmacology, prioritization, and NGN questions. Plus, you get access to a weekly study planner, exclusive NCLEX ebook, and 1 full year of course access. Enroll now. Link is in description. Question 24. Now let us review a public health education scenario involving genetic disorders. The nurse is collaborating with a community advocacy group to raise public awareness about cystic fibrosis. Which statement best describes the underlying nature of this condition? The options are A. It is an inherited disease that causes airway inflammation and hypersensitivity. B. It is an infectious disease that leads to inflammation and fluid buildup in the alveoli. C. It is a genetic disorder that causes thick, sticky mucus to accumulate and block various organs. Or D. It is an acquired condition that results in swelling and inflammation of the epiglottis. The correct answer is option C. It is a genetic disorder that causes thick, sticky mucus to accumulate and block various organs. Cystic fibrosis is a life-limiting autosomal recessive condition that leads to abnormal chloride transport, producing thick secretions in the lungs, pancreas, and other systems. This results in chronic respiratory infections and digestive issues. Asthma, pneumonia, and epiglottitis are not related to the genetic and systemic nature of cystic fibrosis. Education efforts help reduce stigma and promote early screening and intervention. Question 25. In the next scenario, we address a legal and ethical emergency in surgical care. The nurse is caring for an unconscious client diagnosed with a dissecting aortic aneurysm that requires immediate surgical intervention. The client is unable to provide consent, and family members cannot be located. What is the nurse's priority action? The options are A. Proceed with sending the client to surgery. B. Contact the hospital's legal department for guidance. C. Attempt to reach any known contacts for informed consent. Or D. Notify the on-call nursing supervisor and request permission to waive consent. The correct answer is option A. Proceed with sending the client to surgery. The rationale is that in life-threatening emergencies, treatment may proceed without informed consent under the principle of implied consent. Delays in seeking legal advice or family contact could result in death. Nurses should ensure the surgical team is informed and document the emergency nature of the situation. This action supports both ethical care and legal protection in emergent situations. Question 26. Moving into procedural preparation, consider this question about client instructions for a gastric analysis. The nurse is preparing a client who is scheduled for a gastric analysis the next morning at 8 a.m. Which instruction is most important to include in the pre-procedure teaching? The options are A. Instruct the client not to eat or drink anything after midnight. B. Inform the client that chewing gum is acceptable if they feel hungry. C. Advise the client to remain on bed rest for 2 hours after the test. Or D. Tell the client they may smoke up to 1 hour before the procedure. The correct answer is option A. Instruct the client not to eat or drink anything after midnight. The rationale is that gastric secretions must be assessed under fasting conditions to ensure accurate results. Chewing gum and smoking both stimulate gastric acid secretion and must be avoided. Bed rest is not required post-procedure. Proper pre-test preparation supports reliable results and avoids delays or repeated testing. Question 27. Next, let us consider a high-risk lab scenario involving electrolyte imbalance. The nurse is caring for a client with acute kidney injury who has a serum potassium level of 6.1 milliequivalents per liter. Which intervention should the nurse prioritize? The options are A. Obtain a prescription for a diuretic to increase urine output. B. Assess the client's sodium level. C. Place the client on continuous cardiac monitoring. Or D. Encourage the client to increase oral fluid intake. The correct answer is option C. Place the client on continuous cardiac monitoring. The rationale is that hyperkalemia can lead to fatal cardiac arrhythmias, such as ventricular fibrillation or asystole. Monitoring the heart rhythm allows for rapid recognition and treatment of any abnormalities. Diuretics and fluids may be used later, depending on kidney function, but immediate cardiac safety takes precedence. Nurses must respond promptly to abnormal potassium levels, with monitoring and prepare for further interventions as needed. Question 28. Turning now to a delegation scenario, here is a question on clinical validation. While assisting with a bed bath, the unlicensed assistive personnel informs the nurse that the client has foul-smelling discharge at the gastrostomy tube site. What is the nurse's initial response? The options are A. Collect a sample of the drainage for laboratory culture. B. Visually assess the gastrostomy site and drainage characteristics. C. Apply a sterile dressing to absorb the drainage. Or D. Measure the client's temperature to check for fever. The correct answer is option B. Visually assess the gastrostomy site and drainage characteristics. The nurse must always begin by assessing the situation firsthand before proceeding with interventions. Validating the report by examining the site helps determine if infection or irritation is present and what further actions, such as cultures, dressings, or notifications, are needed. Immediate assessment is always the foundation of safe, effective nursing care. Question 29. Let us look at an obstetric emergency that requires prompt recognition. A pregnant client at 37 weeks gestation arrives at the hospital reporting a severe headache, blurred vision, and persistent epigastric pain that is not relieved by medication. Her blood pressure is 160 over 110 millimeters of mercury. Based on these findings, the nurse should suspect which condition? The options are A. Preterm labor, B. Ectopic pregnancy, C. Severe preeclampsia, or D. Mild preeclampsia. The correct answer is option C. Severe preeclampsia. The rationale is that this client meets the criteria for severe preeclampsia based on blood pressure and symptoms like visual changes and epigastric pain, which indicate hepatic involvement. Immediate medical attention is required to prevent complications such as seizures, placental abruption, or fetal distress. The other options do not match the client's gestational age or symptom profile. This scenario highlights the importance of rapid assessment and understanding of pregnancy-related hypertensive disorders. Still stuck in your NCLEX prep? Tired of reading endless books and watching boring lectures with no results? This is your wake-up call. You do not have to study for months. You just need the right strategy. At Stancoast NCLEX Coaching, we have helped thousands of students pass on their first or next attempt. And now, it is your turn. With 100 hours of animated crash course videos, 500 hours of in-depth recorded lectures, 15 CAT-style mock tests, and a 5,000-question NCLEX question bank, we cover everything you need, from test-taking strategy to pharmacology, prioritization, and NGN questions. Plus, you get access to a weekly study planner, exclusive NCLEX ebook, and 1 full year of course access. Enroll now. Link is in description. Question 30. Let us begin this section with a prioritization question in newborn care. The nurse is caring for 4 newborns during their shift. After completing assessments on each, which newborn should the nurse prioritize seeing first? The options are A. A 48-hour-old newborn who has not yet passed meconium. B. A 3-day-old infant with mild jaundice and a bilirubin level of 3 milligrams per deciliter. C. A 3-hour-old infant who has just passed meconium. Or D. A 5-day-old infant with a positive Babinski reflex. The correct answer is option A. A 48-hour-old newborn who has not yet passed meconium. The rationale is that failure to pass meconium within the first 24 to 48 hours can indicate a potentially serious gastrointestinal condition, such as Hirschsprung's disease or meconium ileus. Prompt evaluation is essential to avoid complications from undiagnosed bowel obstruction, mild jaundice, recent meconium passage, and a positive Babinski reflex are expected findings and do not require immediate intervention. Question 31. Now let us transition to a cardiovascular assessment finding. After completing a cardiovascular assessment, the nurse auscultates a harsh, blowing sound while listening to the client's heart tones. How should the nurse document this finding? The options include A. Pericardial friction rub, B. Heart murmur, C. Normal lub-dub sounds, or D. S3 heart sound. The correct answer is option B. Heart murmur. The rationale is that a harsh or blowing sound typically indicates turbulent blood flow through abnormal valves and is described as a murmur. This sound may be systolic or diastolic depending on the valve involved. Pericardial friction rub sounds scratchy or high-pitched. Normal heart sounds lack any blowing quality, and S3 is a soft, low-pitched sound best heard at the apex. Murmurs warrant further evaluation for conditions like stenosis or regurgitation. Question 32. Shifting to infection control education, let us now focus on urinary catheter care. During a staff education session on preventing catheter-associated urinary tract infections, which intervention is most effective in reducing the risk of catheter-associated urinary tract infections? The options are A. Strict sterile technique during catheter insertion and maintenance. B. Using antibacterial urinary catheters for all hospitalized clients. C. Limiting the duration of catheter use and removing it as soon as it is no longer medically necessary. Or D. Administering prophylactic antibiotics to all clients with catheters. The correct answer is option C. Limiting the duration of catheter use and removing it as soon as it is no longer medically necessary. The rationale is that reducing the number of catheter days is the most effective method to prevent infection. While sterile technique is essential, prolonged use is the strongest risk factor for catheter-associated urinary tract infections. Antibacterial catheters and prophylactic antibiotics are not standard practices due to risk of resistance and limited effectiveness. Question 33. Let us now turn to emotional and spiritual care in the hospice setting. A nurse is caring for a client receiving hospice services who expresses, "I feel no real connection with God." What is the most appropriate initial action for the nurse to take? The options are A. Give the client a hug and tell them their life has meaning. B. Arrange for a spiritual advisor to visit. C. Ask the client if they would like to talk more about their feelings. Or D. Call in a close friend or relative. The correct answer is option C. Ask the client if they would like to talk more about their feelings. The rationale is that the nurse should first engage in therapeutic communication by offering a listening presence. Spiritual distress is deeply personal, and creating space for the client to share builds trust and allows assessment of spiritual needs before any referral. Offering comfort or involving others prematurely may feel dismissive or intrusive. Question 34. Moving on to patient confidentiality, here's a question about HIV testing. A nurse is interviewing a client who wishes to undergo anonymous testing for the human immunodeficiency virus. Which type of testing should the nurse recommend? The options are A. HIV home self-testing, B. Rapid testing at a provider's office, C. Inpatient antibody testing, or D. Community health fair rapid testing. The correct answer is option A. HIV home self-testing. This method allows individuals to privately obtain results without creating a record in the healthcare system, preserving full anonymity. Other methods, though confidential, still involve some form of personal identification and may result in mandatory public health reporting. Question 35. Next, let us review pediatric metabolic disorders. A nurse is assessing a 6-month-old infant showing signs of delayed motor development, bowed legs, irritability, and delayed closure of fontanelles. Laboratory values reveal low serum calcium and phosphorus. Based on these findings, which condition should the nurse suspect? The options are A. Cystic fibrosis, B. Osteogenesis imperfecta, C. Rickets, or D. Duchenne muscular dystrophy. The correct answer is option C. Rickets. This condition results from vitamin D, calcium, or phosphorus deficiency and leads to impaired bone mineralization. Clinical signs include skeletal deformities, weakness, and delayed developmental milestones. The lab values further support this diagnosis. The other options involve either muscular or genetic conditions without these characteristic mineral disturbances. Question 36. Let us now focus on fetal monitoring. While observing a laboring client, the nurse notes the fetal heart rate drops from 150 to 120 beats per minute during a contraction, then returns to baseline shortly after. How should this finding be interpreted? The options are A. Late deceleration, B. Moderate variability, C. Early deceleration, or D. Marked variability. The correct answer is option C. Early deceleration. Early decelerations mirror contractions and result from head compression during fetal descent. They are considered normal and typically require no intervention. In contrast, late decelerations suggest placental insufficiency and are more concerning. Question 37. Now let us assess a client with an autoimmune condition. While assessing a client with scleroderma, the nurse is evaluating for expected findings. Which clinical feature is most likely? The options are A. Tophi, B. Janeway lesions, C. Shuffling gait, or D. Taut and shiny skin. The correct answer is option D. Taut and shiny skin. Scleroderma causes thickening and hardening of the skin due to excessive collagen deposition. It may also cause Raynaud's phenomenon and gastrointestinal issues. Tophi are seen in gout, Janeway lesions in endocarditis, and shuffling gait in Parkinson's disease. Question 38. Let us shift to a sensitive topic in pediatric care. During a routine clinic visit, the nurse observes that a 2-year-old child has bruises in various stages of healing and 2 burn marks on the trunk. What is the nurse's most appropriate initial action? The options are A. Confront the caregiver, B. Notify protective services, C. Schedule a reevaluation in 2 weeks, or D. Report to the healthcare provider. The correct answer is option B. Notify protective services. The nurse is legally mandated to report suspected child abuse immediately. Delaying, confronting, or only notifying the provider is inadequate and may endanger the child. Still stuck in your NCLEX prep? Tired of reading endless books and watching boring lectures with no results? This is your wake-up call. You do not have to study for months, you just need the right strategy. At Stancoast NCLEX Coaching, we have helped thousands of students pass on their first or next attempt. And now it is your turn. With 100 hours of animated crash course videos, 500 hours of in-depth recorded lectures, 15 CAT-style mock tests, and a 5,000 question, we cover everything you need, from test-taking strategy to pharmacology, prioritization, and NGN questions. Plus, you get access to a weekly study planner, exclusive NCLEX ebook, and 1 full year of course access. Enroll now. Link is in description. Question 39. To round off this segment, let us look at insulin therapy. A nurse is educating a client on how to use an insulin pump. Which type of insulin is typically used in insulin pumps? The options are A. Rapid-acting insulin, B. Ultra-long-acting insulin, C. Intermediate-acting insulin, or D. Long-acting insulin. The correct answer is option A. Rapid-acting insulin. Pumps use rapid-acting insulin to deliver continuous basal doses and boluses at meals. Long-acting and intermediate insulins are not appropriate for pumps, which require quick onset and flexible dosing to mimic pancreatic function. Question 40. Let us now move to adolescent care and psychosocial support. An adolescent is scheduled for spinal surgery and will remain hospitalized for several days. Which intervention best supports this client's psychosocial needs? The options are A. Encourage parents to stay overnight, B. Arrange for friend visits, C. Suggest patient-controlled analgesia, or D. Provide high-protein meals. The correct answer is option B. Arrange for friend visits. Adolescents value peer relationships, and maintaining social connection helps support identity and emotional health during hospitalization. While pain control and nutrition are essential, psychosocial needs in this age group are best met through peer support. Question 41. In this legal and ethical care question, consider a client with a do not resuscitate (DNR) order, but no advance directive on file. What is the nurse's most appropriate action? The options are A. Inform the physician that a living will is required. B. Verify that the physician has discussed the order with the client or family. C. Accept the DNR order as valid without further action. Or D. Notify the nursing supervisor. The correct answer is option B. Verify that the physician has discussed the order with the client or family. A DNR is valid only when it is based on informed consent. The nurse's role is to confirm that appropriate communication and documentation occurred, even in the absence of a formal advance directive. Question 42. Finally, let us close with a question on cultural and family-centered care. A non-English-speaking client is admitted to the unit and is accompanied by family members. When the nurse begins to collect admission information, the family offers to translate. What is the best nursing action? The options are A. Allow the family to interpret if the client consents. B. Request an official medical interpreter. C. Use simple language and gestures to communicate. Or D. Ask another bilingual nurse to translate. The correct answer is option B. Request an official medical interpreter. The rationale is that certified medical interpreters ensure accuracy, confidentiality, and legal compliance, especially in critical discussions like admission, treatment, and consent. While well-intentioned, family members may misinterpret information or withhold important content. Nurses must follow institutional policies and legal standards to ensure safe and equitable care. Let us move into wound care and microbiology, where proper technique is crucial for accurate results. Question 43 asks, the nurse is preparing to collect a wound culture from a client with a leg ulcer that appears infected. What is the nurse's most appropriate action before swabbing the wound? The options are A. Clean the wound with sterile saline. B. Pat the wound dry with gauze. C. Irrigate the wound with hydrogen peroxide. Or D. Don sterile gloves. The correct answer is option A. Clean the wound with sterile saline. Here is the rationale. Before collecting a wound culture, the nurse should gently cleanse the wound using sterile normal saline to remove surface contaminants like skin flora, which could interfere with identifying the true causative organisms. This step ensures that the sample reflects pathogens from the wound bed itself, not surrounding tissue. Option B is incorrect, because patting the wound dry can disturb the tissue and compromise the culture. Option C is incorrect since hydrogen peroxide is cytotoxic and could distort the sample. Option D is incorrect because while aseptic technique is necessary, sterile gloves are not required. Clean gloves are acceptable for non-sterile procedures like swabbing. Clinically, the preferred Levine technique involves rotating the swab over a clean, viable wound surface to ensure specimen accuracy. Shifting to pain assessment in post-operative care, question 44 presents. A client recovering from a below-the-knee amputation reports ongoing pain in the missing limb. How should the nurse classify this type of pain? The options are A. Perceived pain, B. Somatic pain, C. Neuropathic pain, or D. Nociceptive pain. The correct answer is option C. Neuropathic pain. The rationale is that phantom limb pain is a well-known form of neuropathic pain caused by nerve dysfunction or misfiring. This pain is often described as burning or stabbing and is not associated with active tissue damage. Option A is incorrect as perceived pain is not a clinical classification. Option B is incorrect since somatic pain originates from muscles, bones, or joints. Option D is also incorrect because nociceptive pain is linked to tissue injury, whereas phantom limb pain results from nerve pathway miscommunication. Nurses should know that medications like gabapentin or pregabalin are most effective in managing neuropathic symptoms. Still stuck in your NCLEX prep? Tired of reading endless books and watching boring lectures with no results? This is your wake-up call. You do not have to study for months, you just need the right strategy. At Stancoast NCLEX Coaching, we have helped thousands of students pass on their first or next attempt. And now, it is your turn. With 100 hours of animated crash course videos, 500 hours of in-depth recorded lectures, 15 CAT-style mock tests, and a 5,000-question NCLEX question bank, we cover everything you need, from test-taking strategy to pharmacology, prioritization, and NGN questions. Plus, you get access to a weekly study planner, exclusive NCLEX ebook, and 1 full year of course access. Enroll now. Link is in description. Now let us examine a rehabilitation scenario in question. 45. A nurse is evaluating the rehabilitation progress of a female client with a complete C6 to C7 spinal cord injury resulting in paraplegia. Which observation indicates positive progress in physical therapy? The options are A. The client is able to operate a motorized wheelchair. B. The client expresses a desire to stand with assistance. C. The client states she wants to move her toes. Or D. The client reports regaining bladder control. The correct answer is option A. The client is able to operate a motorized wheelchair. This finding demonstrates preserved upper extremity function and is a key milestone in promoting mobility and independence at the C6 to C7 level. Option B is incorrect because standing requires lower limb control, which is absent in complete paraplegia. Option C, though emotionally valid, is not clinically meaningful for progress assessment. Option D is incorrect as bladder control is not typically influenced by physical therapy alone. The nursing focus here is building upper body strength and setting achievable goals for independence. Let us now transition to acute cardiac monitoring in question 46. The nurse is monitoring a client 24 hours after a myocardial infarction. Which assessment finding should prompt immediate notification of the primary healthcare provider? The options are A. Elevated troponin levels. B. White blood cell count of 13,000 per cubic millimeter. C. Client expresses concern about attending cardiac rehabilitation. Or D. Crackles heard at the mid-lung fields during auscultation. The correct answer is option D. Crackles heard at the mid-lung fields. This finding may indicate the development of pulmonary edema, which is a serious complication due to left ventricular failure post-myocardial infarction. Immediate intervention is needed to prevent respiratory distress. Option A is incorrect because elevated troponin is expected at this stage. Option B reflects a mild inflammatory response, not an emergency. Option C, though important, is not urgent. The priority is to act on signs of physical deterioration, such as fluid overload in the lungs. Shifting to hematology and sickle cell management, question 47 asks, a nurse is caring for a client admitted with a vaso-occlusive crisis due to sickle cell disease. Which assessment finding best indicates that treatment is effective? The options are A. The client reports a reduction in pain. B. The client has an elevated white blood cell count. C. The client experiences increased fatigue during ambulation. Or D. The client exhibits skin tenting over the sternum. The correct answer is option A. The client reports a reduction in pain. Pain relief is the most accurate marker of improved tissue perfusion in sickle cell crises. Option B is incorrect because elevated white blood cell count is typical in crises, but does not indicate improvement. Option C reflects chronic disease symptoms, not treatment effectiveness. Option D shows dehydration, which worsens vaso-occlusive episodes, not improves them. Effective management focuses on hydration, oxygen, and pain control, with decreasing pain as the clearest sign of progress. Next, we move into neonatal pharmacology with question 48. The nurse is preparing to give an intramuscular injection to a neonate. Which needle gauge and length is most appropriate for this procedure? The options are A. 19 gauge, 1.5-inch needle. B. 18 gauge, 1-inch needle. C. 20 gauge, 1-inch needle. Or D. 25 gauge, 5/8-inch needle. The correct answer is option D. 25 gauge, 5/8-inch needle. The vastus lateralis muscle is the preferred IM site in neonates, and this needle size minimizes trauma while delivering up to 0.5 milliliters safely. Option A and B are too large and invasive for neonatal tissue. Option C, while more appropriate for older children, still exceeds the size requirements for neonates. Nurses should always select smaller gauge needles to avoid unnecessary pain or injury during neonatal injections. Now let us shift into emotional support and therapeutic communication in question 49. The nurse is speaking with a recently widowed client who reports difficulty sleeping, shortness of breath, intense anxiety, and a sense of impending doom. What is the most appropriate nursing response? The options are A. Just relax. You are in a safe place now. B. Has something happened recently, or is there anything from the past that may have triggered these feelings? C. The medication I gave you will help ease your anxiety. Or D. Try taking some deep breaths to calm yourself down. The correct answer is option B. Has something happened recently, or is there anything from the past that may have triggered these feelings? This therapeutic, open-ended question invites the client to express their emotional burden while avoiding judgment or assumptions. Option A is dismissive. Option C overly emphasizes pharmacologic solutions. Option D can feel minimizing in high distress. Empathetic, non-directive conversation is essential when supporting grieving clients. Next, we move into neurological assessment with question 50. The nurse observes a nursing student during a physical assessment. Which action by the student correctly demonstrates how to assess for stereognosis? The options are A. Ask the client to close their eyes and identify an object in their hand. B. Observe for balance with feet together and eyes closed. C. Ask the client to walk on heels and toes. Or D. Have the client touch their nose with their index finger. The correct answer is option A. Ask the client to close their eyes and identify a familiar object by touch. This sensory test evaluates parietal lobe function. Option B describes the Romberg test for proprioception. Option C tests cerebellar strength. Option D assesses coordination but not stereognosis. This test is vital for identifying tactile recognition issues linked to stroke or brain lesions. Question 51. Let us explore the scope of practice and delegation. The charge nurse is assigning responsibilities to an unlicensed assistive personnel. Which task is appropriate to delegate? The options are A. Collecting a urine sample from an indwelling catheter. B. Increasing oxygen flow rate via nasal cannula. C. Recording drainage collected in a suction canister. Or D. Removing a nitroglycerin patch. The correct answer is option C, recording the amount of drainage collected in a suction canister. This task is routine and non-invasive and does not require sterile technique or clinical judgment. Option A requires sterile technique, making it inappropriate for UAPs. Option B involves medication regulation. Option D includes handling medications, which is restricted to licensed staff. Always delegate within scope and ensure patient safety. Still stuck in your NCLEX prep? Tired of reading endless books and watching boring lectures with no results? This is your wake-up call. You do not have to study for months. You just need the right strategy. At Stancoast NCLEX Coaching, we have helped thousands of students pass on their first or next attempt. And now it is your turn. With 100 hours of animated crash course videos, 500 hours of in-depth recorded lectures, 15 CAT-style mock tests, and a 5,000-question NCLEX question bank, we cover everything you need, from test-taking strategy to pharmacology, prioritization, and NGN questions. Plus, you get access to a weekly study planner, exclusive NCLEX ebook, and 1 full year of course access. Enroll now. Link is in description. Finally, question 52 dives into cultural competence and medication adherence. A client diagnosed with hypertension tells the nurse that she prefers to use an herbal supplement instead of her prescribed antihypertensive medication. What is the most appropriate nursing response? The options are A. Herbal supplements are unsafe. B. You should speak with your healthcare provider. C. Check your blood pressure every 15 minutes. Or D. We will monitor your blood pressure very closely. The correct answer is option B. You should speak with your healthcare provider about using herbal supplements. This response encourages collaboration, respects client autonomy, and ensures safety by assessing for potential interactions. Option A is overly judgmental. Option C is impractical. Option D skips the critical step of provider consultation. Nurses should promote safe, non-judgmental discussions around alternative therapies. Let us now turn our attention to a classic prioritization scenario in acute care. Question 53. The nurse is reviewing a list of new medication orders for several recently admitted clients. Which medication should the nurse administer as the top priority? The options include A. Administer aspirin to a client showing signs of an acute myocardial infarction. B. Give lisinopril to a client with a history of essential hypertension. C. Administer risperidone to a client diagnosed with schizophrenia. Or D. Provide levodopa, carbidopa to a client with Parkinson's disease. The correct answer is option A. Administer aspirin to a client showing signs of an acute myocardial infarction. Here is the rationale. Administering aspirin as soon as possible in a client presenting with myocardial infarction symptoms is a time-sensitive, life-saving intervention. Aspirin inhibits platelet aggregation, which helps limit the growth of the thrombus obstructing the coronary artery. This reduces myocardial damage and improves survival. In contrast, Option B involves a long-term antihypertensive not urgently needed unless blood pressure is critically elevated. Option C relates to chronic psychiatric management and is not immediately life-saving. Option D addresses Parkinson's symptoms, which are not prioritized over cardiac emergencies. In NCLEX prioritization questions, life-threatening and time-sensitive conditions always come first, just like myocardial infarction. Next, let us consider a client education scenario 54 involving peripheral arterial disease. The nurse is reinforcing teaching for a client newly diagnosed with peripheral arterial disease. Which of the following statements made by the nurse would require correction? The choices are A. Engaging in daily exercise can improve blood flow to the legs. B. Clients who smoke should be encouraged to quit as soon as possible. C. It is beneficial for clients to rest with their legs in a dependent position. Or D. We will provide devices that elevate the legs above heart level for home use. The correct answer is option D. We will provide devices that elevate the legs above heart level for home use. Now, here's the rationale. In peripheral arterial disease, elevating the legs above the heart actually decreases arterial perfusion to the lower limbs, worsening ischemic symptoms. These clients benefit from keeping their legs in a dependent position to enhance gravity-assisted blood flow. Option A is accurate. Regular walking promotes the development of collateral circulation. Option B is also correct because smoking is a key risk factor for peripheral arterial disease, and cessation is critical. Option C is therapeutic, as dependent leg positioning relieves claudication pain. This question highlights the importance of correcting misconceptions during client education. Now, let us shift into pediatric anatomy for the next clinical question, 55. During a pediatric airway assessment, the nurse recalls that which laryngeal structure forms a complete ring and represents the narrowest portion of the airway in young children. The options are A. Hyoid, B. Arytenoid, C. Cricoid, or D. Thyroid. The correct answer is option C. Cricoid. The rationale is that the cricoid cartilage is the only complete cartilaginous ring in the pediatric airway and is anatomically the narrowest portion in children under 8 years old. This makes it a critical structure to consider during airway management, particularly for intubation and cricoid pressure application. Option A, the hyoid supports the tongue but is not part of the airway ring. Option B, the arytenoids control vocal cord movement but do not encircle the airway. Option D, the thyroid cartilage, forms part of the anterior larynx but does not form a complete ring. Knowing these anatomical differences is vital in pediatric nursing, especially during airway emergencies. Moving into psychiatric nursing, let us look at a question about therapeutic environments. Question 56. During a staff education session on milieu therapy, which statement should the nurse emphasize as most reflective of this therapeutic approach? The options are A. Milieu therapy focuses on physical wellness and is only used in inpatient psychiatric settings. B. The goal of milieu therapy is to help clients build emotional bonds with members of their community. C. The key components of milieu therapy include the structured setting, consistent routines, and the emotional environment that promote client healing. Or D. Milieu therapy follows an unstructured approach where clients self-direct the rules of the therapeutic setting. The correct answer is option C. The key components of milieu therapy include the structured setting, consistent routines, and the emotional environment that promote client healing. Here is the rationale. Milieu therapy involves using the entire therapeutic environment to foster recovery and emotional safety, especially in psychiatric settings. It includes structure, staff involvement, consistent routines, and peer interactions. Option A is incorrect because milieu therapy is not limited to inpatient care and is not focused solely on physical health. Option B misrepresents the goal, which is about healing within the setting itself. Option D is inaccurate because the environment is structured, not unregulated. This question emphasizes the nurse's role in maintaining therapeutic structure. Now, turning to emergency care, here's a question about shock management. Question 57. A client presents to the emergency department with suspected septic shock. Which action should the nurse prioritize first? The options are A. Establish a peripheral intravenous access for rapid intervention. B. Page the infectious disease specialist for a consult. C. Reassure the family by providing frequent updates. Or D. Perform a focused physical examination for infection source. The correct answer is option A, establish a peripheral intravenous access for rapid intervention. Here is the rationale. Septic shock is a life-threatening condition that requires immediate fluid resuscitation and administration of broad-spectrum antibiotics. Establishing intravenous access is essential for delivering these interventions within the first hour of diagnosis, as recommended by sepsis treatment protocols. Option B, consulting infectious disease, may be done later but does not take priority. Option C, family support, is important but secondary to life-saving care. Option D, physical assessment, is necessary, but not before the initiation of critical interventions. This reinforces the NCLEX concept of first action in emergency prioritization. Finally, let us look at a pharmacological intervention in hepatology. Question 58. A client with advanced liver cirrhosis is prescribed an albumin infusion. What is the primary therapeutic goal of administering albumin to this client? The options are A, to elevate platelet levels, B, to correct electrolyte abnormalities, C, to restore oncotic pressure and reduce fluid shifting, or D, to stimulate red blood cell production. The correct answer is option C, to restore oncotic pressure and reduce fluid shifting. Now for the rationale. In cirrhosis, the liver's ability to produce albumin is compromised, leading to hypoalbuminemia and third spacing of fluid, such as ascites. Administering albumin helps pull fluid back into the vascular compartment, supporting blood pressure and reducing peripheral edema. Option A is incorrect because albumin does not affect platelets. Option B is also incorrect. Electrolyte imbalances require specific replacements. Option D is incorrect because albumin has no role in red blood cell production. Albumin infusion is often used in cirrhosis, nephrotic syndrome, and post-paracentesis care to support fluid balance and circulation. Question 59. Let us now move into the realm of delegation, a crucial part of safe and efficient nursing care. The nurse is assigning tasks to an unlicensed assistive personnel, UAP. Which action would be the most appropriate to delegate? The options are: take a tympanic temperature on a client who received naproxen 1 hour ago, empty and record output from a surgical drain, assist a client in choosing low-sodium foods from the dietary menu, or transport a client receiving intravenous dopamine to the intensive care unit. The correct answer is option A, take a tympanic temperature on a client who received naproxen 1 hour ago. UAPs are qualified to obtain routine vital signs, including tympanic temperatures, and the administration of naproxen does not make this task unsafe. In contrast, surgical drain management involves clinical assessment, dietary teaching involves decision-making and patient education, and clients on vasoactive medications like dopamine require close monitoring during transport by a licensed nurse. Remember, only non-complex tasks that do not require clinical judgment should be delegated. Question 60. Shifting now to laboratory interpretation, the nurse is reviewing the results of several clients. Which of the following findings requires the most immediate follow-up? Your options are: a total cholesterol level of 180 milligrams per deciliter, a hemoglobin A1C of 7.5% in a diabetic client, a calcium level of 9.2 milligrams per deciliter, or a serum creatinine of 1.0 milligrams per deciliter. The correct answer is option B, hemoglobin A1C of 7.5% in a client with diabetes mellitus. This value indicates poor glycemic control, putting the client at increased risk for complications such as nephropathy and retinopathy. In contrast, the cholesterol, calcium, and creatinine levels listed are all within normal limits and do not demand urgent action. For diabetic clients, the goal A1C is generally below 7%, so values above that threshold should prompt reassessment of treatment plans. Question 61. Let us now calculate fluid intake, an essential nursing responsibility. The client received 2 100 milliliter intravenous antibiotics, 2 8-ounce cups of ice chips, 1 8-ounce cup of coffee, and 3 8-ounce cups of water. What total intake should be recorded in milliliters? The correct answer is 1,400 milliliters. Here is how we calculate it. 2 IV antibiotic doses equal 200 milliliters. For the 2 cups of ice chips, we calculate 2 cups times 240 milliliters, divided by 2, resulting in 240 milliliters. Add the coffee at 240 milliliters, and 3 cups of water equals 720 milliliters. The total is 200 plus 240 plus 240 plus 720, giving us 1,400 milliliters. Always remember to divide ice volume by half, as it melts and occupies less space. Accurate fluid tracking is vital in managing hydration, renal function, and fluid balance. Still stuck in your NCLEX prep? Tired of reading endless books and watching boring lectures with no results? This is your wake-up call. You do not have to study for months. You just need the right strategy. At Stancoast NCLEX Coaching, we have helped thousands of students pass on their first or next attempt. And now, it is your turn. With 100 hours of animated crash course videos, 500 hours of in-depth recorded lectures, 15 CAT-style mock tests, and a 5,000-question NCLEX question bank, we cover everything you need, from test-taking strategy to pharmacology, prioritization, and NGN questions. Plus, you get access to a weekly study planner, exclusive NCLEX ebook, and 1 full year of course access. Enroll now. Link is in description. Question 62. Next, we move into therapeutic communication, especially in emotionally charged environments. A family member appears overwhelmed while visiting a mechanically ventilated client receiving multiple intravenous therapies. What is the best nursing action? Options include allowing the family to be alone, reminiscing about the client's past, offering pastoral care, or clearly explaining current treatment. The correct answer is option D, provide a clear explanation of the client's current treatments and therapies. This approach uses both empathy and education to reduce fear and empower the family. Leaving them alone or shifting the conversation to past memories may not address their immediate anxiety. And while pastoral care can be helpful, the nurse's role in communication comes first. Always begin by offering clarity and support before escalating to ancillary services. Question 63. Now, let us focus on a fundamental obstetric assessment skill. The nurse is preparing to perform Leopold maneuvers on a pregnant client. What is the main purpose of this procedure? The choices are: identify fetal position and presentation, prevent vena cava compression, assess uterine involution, or confirm rupture of membranes. The correct answer is option A, identify the fetal position and presentation within the uterus. Leopold maneuvers involve specific hand placements on the maternal abdomen to determine fetal lie, presentation, and engagement. They are typically done after 24 weeks of gestation. Vena cava compression is addressed through positioning, not palpation. Uterine involution is a postpartum concept, and rupture of membranes is confirmed using tests like the Fern or nitrazine test, not through Leopold maneuvers. These assessments help guide birth planning and anticipate delivery complications. Question 64. Let us begin this segment with a high-stakes scenario in adolescent mental health. While caring for an adolescent prescribed paroxetine, which client statement should the nurse prioritize for immediate follow-up? The options include, this medication makes me feel really tired. I've noticed I have put on some weight since starting it. Lately, I just feel like giving up on everything. Or, this medicine always upsets my stomach. The correct answer is option C. Lately, I just feel like giving up on everything. This verbal cue reflects a critical level of hopelessness, which must be taken seriously, especially in adolescents prescribed selective serotonin reuptake inhibitors such as paroxetine. These medications carry a black box warning for increased risk of suicidal ideation in this age group, so any indication of giving up must trigger an immediate safety intervention. While tiredness, weight gain, or stomach upset are common side effects of SSRIs, they do not represent a psychiatric emergency. Always remember, statements about hopelessness or self-harm must prompt an immediate mental health assessment. Question 65. Now moving into the world of post-operative care, especially hand surgery rehabilitation. A nurse is creating a care plan for a client who recently had hand arthroplasty. Which nursing intervention should be avoided to prevent complications? The options are: encouraging range of motion exercises, keeping personal items within reach on the non-operative side, resting the operative arm on a pillow, or promoting the use of the non-operative arm. The correct answer is option C. Rest the operative arm on a pillow to maintain elevation. Although elevation is often advised after surgery, directly resting the arm on a pillow, especially for long periods, can cause ulnar nerve compression. After hand arthroplasty, this nerve is vulnerable due to post-operative swelling and inflammation. In contrast, exercises, safe positioning, and encouraging independence using the unaffected limb are all supportive, not harmful. Protecting the ulnar nerve is vital, and nurses should elevate the limb without placing direct, prolonged pressure. Question 66. Let us shift to pediatric vaccine safety, a topic that often brings parental concern. A 2-month-old infant develops a fever 3 days after receiving the diphtheria, tetanus, and pertussis vaccine. What should the nurse say? Options include avoid future doses. This is a serious reaction. It is normal for a mild fever to occur, or you may give ibuprofen to manage it. The correct answer is option C. It is normal for a mild fever to occur after this vaccine. A low-grade fever within 48 hours is an expected immune response and typically resolves on its own. It signals the body is forming immunity. Discontinuing the vaccine series is not warranted, and ibuprofen should not be used in infants younger than 6 months. In this age group, acetaminophen is the safer antipyretic choice. Calm parental worries with education. Mild fever post-vaccination is not a cause for alarm. Question 67. Now on to a subtle yet significant skin finding in cardiology. During an assessment of a client with infective endocarditis, the nurse observes flat, painless red macules on the palms and soles. What do these lesions indicate? The options are Heberden's nodes, Janeway lesions, tophi or Bouchard's nodes. The correct answer is option B, Janeway lesions. These non-tender, flat reddish macules are a hallmark sign of septic emboli related to infective endocarditis. They typically appear on the palms and soles and may aid in clinical diagnosis, especially in clients with valve infections. In contrast, Heberden's and Bouchard's nodes are linked to osteoarthritis, while tophi are associated with chronic gout. Recognizing Janeway lesions can be critical in supporting early diagnosis of endocarditis in high-risk individuals. Question 68. Moving forward to medication timing, something that significantly affects drug safety. A client is prescribed prednisone. When should the nurse recommend taking this medication? The options are in the morning, around noon, at bedtime, or any consistent time. The correct answer is option A, in the morning. Prednisone mimics the body's natural cortisol rhythm, which peaks in the early morning hours. Taking it before 9 a.m. reduces the risk of adrenal suppression and avoids insomnia that may result from evening doses. While consistency is important, morning administration aligns with physiologic hormone patterns. Educating clients on this timing supports both effectiveness and tolerance of the medication. Question 69. Let us now look at a life-threatening cardiac complication. The nurse is monitoring a client for cardiac tamponade. Which set of vital signs most clearly supports this diagnosis? The options are a heart rate of 109, respiratory rate of 26, and blood pressure of 88/71, or other combinations of vital signs. The correct answer is option A, heart rate of 109 beats per minute, respiratory rate of 26 breaths per minute, and blood pressure of 88/71 millimeters of mercury. These findings reveal a classic presentation of cardiac tamponade: hypotension, tachycardia, tachypnea, and narrowed pulse pressure. These signs indicate impaired ventricular filling and cardiac output. The nurse should act immediately to prepare for pericardiocentesis. Always remember the triad: muffled heart sounds, hypotension, and jugular venous distension as your red flags. Question 70. Now turning to nutritional support in acute care. A client has been receiving total parenteral nutrition for the past 12 hours. What should the nurse monitor most closely at this stage? Options include urine output, temperature, weight, or capillary glucose. The correct answer is option D, monitoring capillary blood glucose levels. TPN contains high concentrations of dextrose, making hyperglycemia a common early complication. Blood glucose must be monitored every 4 to 6 hours, particularly during the first day. Urine output, weight trends, and temperature are important, but do not take precedence immediately after initiating TPN. Managing glucose is key to preventing metabolic instability in these clients. Question 71. And finally, let us end with a question focused on post-medication monitoring. The nurse evaluates multiple clients who just received their prescribed medications. Which report requires the most urgent intervention? The options are nausea during amphotericin B infusion, palpitations after insulin, drowsiness after fentanyl, or perineal itching from dexamethasone. The correct answer is option B, complaints of palpitations after receiving rapid-acting insulin. This symptom may signal early hypoglycemia. which can escalate rapidly into seizures or unconsciousness if left unaddressed. Adrenergic symptoms like palpitations, anxiety, and tremors are early clues. In contrast, amphotericin B often causes nausea, fentanyl leads to expected sedation, and perineal itching with dexamethasone is benign. Always prioritize symptoms suggestive of life-threatening complications, especially those involving blood glucose or airway compromise.